My name is Trista, and I'm here to give you some general information about diabetes mellitus. I know it seems scary, but this disease is completely manageable as long as you follow the directions your veterinarian will be giving you. Diabetes mellitus is caused by the lack of insulin or insufficient use of insulin in your pet's body. The pancreas produces insulin, which responds to high blood sugar levels, also known as high blood glucose levels. When this happens, it brings the blood glucose levels down. If the insulin is not there or does not respond properly, those blood glucose levels stay high. Now what happens with that, your dog then in turn starts having problems with metabolizing carbohydrates, fats, proteins, lack of energy, everything your dog needs, just not happy body. So what we're going to do is hopefully get your pet's body back to a healthy state. It's going to start with a stabilization period. What that means is you're going to start with small doses of insulin and work your way up to a final dose. The final dose is what's going to make your dog happy and keep your dog's blood glucose levels within normal ranges. Along with insulin, your veterinarian will also give you a prescribed diet. This is also very important. It will usually be a low carbohydrate, high protein diet. As I mentioned before, metabolizing carbohydrates can be a problem with pets who have diabetes mellitus. So it's important to follow your prescribed diet for your pet. No table food, not even, one piece of popcorn won't hurt. It will hurt. You need to follow the prescribed diet that your vet has given you. A couple other things you want to think about. We have a wonderful website that we have found that gives you a breakdown of what you will need. You will need blood glucose test strips, which we have here, which usually come with a whole kit. You have your glucose meter, you have your lancet, which will actually poke the skin to give you your blood. You have blood glucose strips, so you'll definitely need this because you will be testing your dog's blood glucose levels on a regular basis. You will need your insulin and syringes. You'll need a sharps container, of course, your proper food by your veterinarian, and it's important to stay in touch with your veterinarian. Have regular visits, keep in touch with them. That's crucial in maintaining the care of your pet. Also, if you have a pet that goes to a pet sitter or is going to be boarding for any reason, you need to make sure that these sitters or boarding facilities are familiar with your pet's disease and how to properly treat them. Insulin comes in two different types. You have U40, which is 40 units per ml, and you have U100, which is 100 units per ml. The important part of this is if you have a U40 insulin, you need to use a U40 syringe. If you have U100 insulin, you need to use a U100 syringe. Don't interchange them. U40 is for smaller doses of insulin. And of course, this will depend on your pet's size and what's going to get their levels within normal ranges. Your veterinarian is going to determine that. But with a U40 insulin, it's for smaller doses, and a U40 syringe, if you're drawing up smaller doses, it's going to be easier on that smaller syringe. You don't want to try and draw up a smaller dose on a larger syringe. So make sure you have the proper syringe for the proper insulin. Also, insulin. Make sure you store it in the refrigerator, not the freezer. It's not meant to be frozen. Needs to be stored in the refrigerator. I hope that's given you just a little bit of information at the end of our video after I've shown you how to properly test for blood glucose levels and show you how to give a proper insulin injection. There will be a list of websites that you can do further research to help you fully understand the problem your pet's having. There's no better way to care for your pet than to understand what's going on with them. Now we're going to be showing you how to test your dog's blood glucose levels at home. You want to start with loading your lancing device. You want to take your lancet, place it firmly in the holder, remove the lancet end cap, which the needle is very, very small. Your puppy probably won't even feel it. I know it's scared to stick your puppy sometimes. Now it's ready to go. Next, you want to take your glucose meter and make sure it's ready. You want to take a glucose strip, insert it into your meter. Your meter will come on, and once it's cleared out, it's ready to go. There's 3 different areas I'm going to show you today that you can get just a tiny drop of blood, which is all you need. One area is the inside of the upper lip. You want to pull the lip back. You can use paper towel to dry the area. You want to apply your lancet, push the button, and you should get a little bitty drop of blood. You want to apply your test strip till it fills up and you will get your reading. Another area, you can do the inner ear, right around here. You want to make sure you rub the ear to get the blood flowing beforehand. And the final area I'm going to show you, Stitch doesn't have any, but right here, can you turn around for me, buddy? Right here, some dogs have calluses. You can actually get a sample from there as well. Just make sure, as you did with the ear, that you rub beforehand to get the blood flowing. Now we're back with Stitch again to show you how to give your dog an insulin injection. Your insulin should be refrigerated, so when you pull it out, you want to mix it gently. To mix your insulin, you want to roll between your hands like this. You never want to shake up and down or side to side. You want to lay it in your hand and gently roll in this motion. You want to take your syringe, draw up the proper dosing. You want to take the skin in between the shoulder blades and you stick your finger right there and it gently makes a 10. You insert your needle, inject the insulin, and you're done. The only thing from day to day, you want to move around a little bit, not to cause irritation by injecting in the same spot every day.